My name is Carmel Schramm. I'm from a small town in Wisconsin called Rhinelander. I'm 50 years old, and I have had a lifetime of a right knee problem. It started at the age of 14 with radical surgery at that point, and that created ongoing issues for the remainder of my life. We saw many doctors looking for easing my pain without success because of my age. They did not want to do additional surgeries or a knee replacement. The last year of my life was intolerable pain-wise, hard for a doctor in a place that would give me a knee replacement. Looking in the United States became a situation that we could not do because it's a pre-existing condition, so our health insurance in the United States would not cover it. So I searched on the internet looking at Thailand and Costa Rica and India for a good hospital and a good surgeon. So looking very closely at infection rates at hospitals and success rates and talking to previous patients, I zeroed in on Wockhardt Hospital because they met my criteria. I focused in on was Dr. Sanjay Pai, and what drew me to him was his level of experience. He does about 500 knee replacements a year, so he and his team are experts. The small town I come from, the doctor may do 12 a year. So even though he was not an option because of insurance reasons, Dr. Pai would have been a far greater choice anyway because of the level of experience. So I felt extremely comfortable coming to India. We were received in India in the middle of the night, met at the airport. After being received into the hospital and my vitals were checked, I was okayed for surgery and taken right for surgery the next day. Moving from the ICU department back to my room, I had constant care from a different number of doctors, from the traditional general doctor that would check my vitals daily to the whole orthopedic staff that would visit me, as well as all the marketing directors of Wockhardt to make sure that my needs and my husband's needs were being satisfied. And we could not have asked for anything else, from the nursing care to making sure my pain was managed, to the diet required by us, to the daily physical therapists. All went smoothly, and the 8 days spent there, we were made to be as comfortable as possible. My knee was in good condition for me to be discharged at that point to move on to outpatient physical therapy. So I felt comfortable that I was getting the best care that was available. So it overall has just been an extremely positive experience. I'm about to travel back to the U.S. and I'm doing so with a complete plan for how to proceed with my physical therapy for the next 18 months. And I know that all will go well. A major difference that I found between the United States hospitals and the hospital, Wockhardt Hospital here in India, was that they recognized that this was major surgery, that I did not have surgery on one day and was just discharged the next day or two, which would have required you to go back to the hospital every day for checks. At Wockhardt, I was stayed admitted to that hospital until I was physically ready to leave and could manage on my own to a degree. Another major difference that my husband and I were delighted with to find out was that the hospital food did not taste like typical hospital food. We were allowed to select from an Indian diet or an American diet, and our choice was to experience the Indian culture, and the food was wonderful. It was definitely restaurant quality food, we felt, compared to Indian restaurants in the U.S. And the food service people checked with us on a daily basis to be sure that we had enough, that it was meeting our dietary requirements, and it was made the stay much more pleasant too. all vehicles approaching the hospital and people coming into the hospital. Bags are checked as people want to enter the hospital. And in addition, every evening, security would come by my room to make sure that I was there, comfortable. And if I would depart from my room, security was there to make sure that all of my things were safe. So that again gave us a level of comfort that I'm not aware of occurs in the United States. India is it's a safe option, it's an affordable option, and things can happen in a matter of days. So please don't suffer. Look at the options available.